Doc Ellis, your HIC doctor from Oklahoma City, March 7th, 2025. Federal workers' comp, VA disability, and FERS disability are very fair. You're not turned in the wrong place. Why? They're supposed to be non-adversarial. You're in the right place. Why all the problems? I mean, the laws are ridiculously fair. Say for federal workers' comp, if employment factors contribute the slightest amount, it's 100% covered. If it's pre-existing and it's aggravated, the slightest amount, it's 100% covered. Same way FERS disability and VA disability. Then why all the denials? Why all the crap? Okay, one of the problems is the white coat. White coat. 50% of litigation regards a doctor's report. All we learn in medical school is that lawyers don't go to heaven, and malpractice prevention. So we don't know how to fill out forms. Federal workers' comp claim, or FERS retirement claim, or a VA disability, and you want your local doctor to do it. If they're not trained in this, you shouldn't do that. They should know how to do it. Okay, and then for training by the federal employees. Okay, but the big problem is the bias against the injured employees. If you have to file a claim for workers' comp or retirement or VA disability, you're a scuzzball, you're a liar, you're a cheat. You're just lumped in. There's a bias that people don't even know they have. Okay, so that's enough overview. Don't give up. The law's on your side. You just have to have people that have balls and know how to get the government to pay attention to their own laws. Okay, here's question one from Dawn from PA. United States Postal Service, 30 years, letter carrier. Then anything in your body is covered. Last 6 months, diagnosed osteoarthritis, torn hip labrum. I'm sure your knees, your ankles, or anything. So you need to file a CA2. That's a cumulative trauma. There are three kinds of claims in federal workers' comp: an acute injury, CA1 form; a cumulative trauma like carpal tunnel or your hip, and from all the letter carrying. That's that. And now later, if you've retired or something, you can do a CA2A. Don't worry about that. So you file a CA2. Now, this is what I recommend you do. You Google Form CA2, look it up, and it'll tell you. And you come up with an employee statement and explain your job description and go into detail. If little old ladies knew what a letter carrier did to get ready to deliver the mail, all the sorting in the morning, they'd stop sending Christmas cards. I mean, this is hard work. Okay, no, yeah. And then you describe that. Then you get a doctor to write a medical report. Now, there's your problem. Most doctors, I mean, really, most doctors have no clue how to write a federal workers' comp medical rationale report. But to get somebody who does, you may have to come all the way from New Jersey to Poto, Oklahoma. That's tough. That's the deal. Okay. Winnable? Absolutely winnable. Now, let's say you've got a bad claims examiner fight it. We do an oral hearing. If that doesn't work, we go to Employee Compensation Bill Board. The law's on your side. You just make sure the clinic or doctor you're doing does all that stuff, because you don't need a lawyer in federal workers' comp. The people that do this should do it. Now, here's the problem. If you do state workers' comp, you're going to be doing depositions. If you do motor vehicle accident, personal injury, you're going to do video depositions. You're going to go live to court. A lot of people do workers' comp, federal workers' comp, and they don't do oral hearings. Then don't do them. Don't do that. Don't cherry pick, or they don't take things to the Employee Compensation Board. So you've got to go to a full service people, and there are very few of those out there, because I'm advertising for myself. But that's just the truth. Okay, so that's a winnable case, especially post office. Okay, now remember, if you had a pre-existing condition, then it's made worse, then it's covered. For, let's say you've retired after 10 years, and you've had a claim on your hip or whatever, then the other hip starts bothering you. That's a consequential injury. That can be winnable too. It's a harder thing to win, but it's medically reasonable. Okay, so sure, do that. Okay, And this is Robert from Pennsylvania. Okay. Service-connected sleep, depressive disorder, 7%. Obstructive sleep disorder, 50%. Tinnitus, at 10. Hearing loss, rated at 0, but he still has hearing loss. Now, recently diagnosed with an AV block and got a pacemaker. Tinnitus contributes to hypertension, which contributes to stress on the heart and the AV node, and would make you more prone to developing disorder of that AV node, and that would make it service connected. Sleep disorder, you're missing oxygen during the night. That's not good for your heart. That would make that AV node and pacemaker service connected. Remember, the VA law is very fair. Now, if it were a state workers' comp, I wouldn't even let you pay me to come in because it's a higher criteria. But VA law is very fair, so I'll apply it. Let's apply it. Janine, I had over a second for my PTSD for federal workers' comp. Got report back, and they're a year apart. The second opinion was not given true facts when he said, I don't drive, but I do drive. And grown kids. I drive about 5. Okay. And she's concerned about the difference in the history. They call her a liar. That's not going to happen. You can just get another report. And if someone does, you just overcome what someone did. Obviously, someone misquoted you. Happens all the time. It can be taken care of. Okay. Now here we're talking about, I also had a follow-up to get more physical therapy. It takes a few visits to get built back up. My doctor decided that workers' comp would say no and decided not to fill out the paperwork. Get a new doctor. Lord. Okay. And I understand. Almost doctors and lawyers, I've done one federal, never do another one. I understand the exasperation they have. But if you're not willing to go to war, don't go to war. Okay. So more physical therapy. My primary care doctor sent me for PT. Now you're going to have to do that under health insurance because unless they fill out the forms right, workers' comp is not going to pay for it. All right. Okay. And then sounds so many things wrong. Not to do PT until your blood pressure, hypertension, and control. PT will help your blood pressure. Had 2 surgeries for knee, same knee, the knee replacement, left wrist broke, T-bar fall due to physical. Hey, that T-bar breaking and your physical therapy, if you're doing physical therapy for an accepted workers' comp claim, that broken wrist becomes a secondary workers' comp claim. Or let's say you're getting physical therapy and they hurt you. That's a secondary claim. It's work related. Now it's going to be an uphill battle to win it, but if you don't give up, you'll win it. Okay, this is okay. Here's regards to claims examiner not responding with a denial. Would it be helpful to send in a written correspondence to DOL, letting them know that your doctor sent out medical requests? And I was just thinking it'd be a good thing to leave. Okay, all right. So you have a claims examiner with a 12th grade education. No legal training, no medicine training. Now, if they don't give you a denial, you can't ask for an oral hearing. I've had people. So this is my neighbor said I've done one federal workers' comp. The case was the claims examiner would not give a denial, and so he helped out. So he files a claim in district court for the OWCP claims examiner to either accept the claim or give us a denial. And instead of the government just saying denied so you could go on down the road, they sent a letter to the judge that you don't have jurisdiction, which is true. I mean, good Lord, government, you arrogant bureaucrats. So you've got to get a denial so that you can ask for an oral hearing. And now, by the way, every time I've done an oral hearing, the hearing officers are very logical, very honest. They know the law, well prepared, as if they're going to the Supreme Court. And the law speaks for itself, and you always win if you know what you're doing and you're telling the truth. But it's getting the claims examiner off their butt to at least give you a denial. I had a case that the guy is crushed by a forklift. He's in a coma, sent to the emergency room at the university. They CT his head, his neck, and of course they're worried about his tummy and whether he's got a ruptured spleen, liver, blah, blah, blah. And kind of forget to put on the final diagnosis, brain damage and neck injury. So the claims examiner doesn't read all the records to show that that was the original, that is a diagnosis, I think. So it doesn't approve it. Although and guy comes in with a coma, come on, all right, and then tells this poor guy with brain damage, really bad brain damage, I will never accept your neck, and because we didn't get to see him until 6 months later. And what he's got more than neck injury. He's got a spinal cord injury like Superman. So we had to do emergency surgery. I had to do it on health insurance because we could not get the claim examiner off data. And so 4 years later, after neck surgery, we finally got the neck surgery approved. 35-year-old guy with neck surgery that was in a coma. That's coincidental. This is just the bullshit I put up with. And that claims examiner should, now if it was an insurance company, that's $40 million bad faith claim. But that's just fraud. And she tells this guy with brain damage, I will never accept your neck. I sent her an MRI picture in color with arrows showing the dented spinal cord. Now, part of the problem is the university, I see him 6 months later. And from 50 feet away, I make the diagnosis that it's a spinal cord injury. Well, he's actually going to a neurosurgeon, and the PA is used to talking about a nerve in the spine going out in the arm, a spinal nerve. This is a spinal cord injury. From 50 feet away, his left arm and leg, and he's having a cane. It looks like he had polio as a kid. That is not a spinal nerve. That's a spinal cord like Superman. Okay? Clearly on the MRI. So we had to do a surgery, an emergency under health insurance.
Yeah, but thank you for answering that question.
Okay, good. So there you go. But now send stuff in. You see a second opinion doctor. You only spent 20 minutes with me. Send it into the claims examiner. Send it into the Department of Labor. Sometimes somebody responds it. Okay. Now this is Mark. Something about what about cervical C7, C-spine ongoing? Well, that's covered in federal workers' comp and VA disability. Depends on what the cause is. So, okay, now here's doesn't say who it is.
JT.
Oh, JT. Oh, I thought it said IT. JT was denied because they said my weight was caused by sleep apnea. Well, sure, your weight caused sleep apnea. Now, if this is VA, did you gain weight in the service, or did you have, say, flat feet or a sprained ankle or back injury? Anything that cut down your exercise, your activities of daily living. If it cuts down your activities of daily living that much, like a bad knee or sprained ankle or March fracture of my metatarsal bone, then that adds to weight gain, and that makes sleep apnea service connected. I think that's our question. You got anything else? Oh, I'm on that. The VA, this is beware of predators. This is good for the VA here, who want to prey on your benefits. There are companies out there advertising, and the VA says, make sure that they're VA accredited claims agents, attorneys, and veteran service organizations. Like American Legion, all those veteran service organizations are VA accredited, or the VFW, or each state's a VA commission is accredited, because some of these people will ask for a piece of your settlement of your disability, which is unethical. Congress passed a law make that illegal, and they're charging ridiculous fees. I've had people coming in, so be careful. And then they'll hire doctors to lie about anything, and you don't want that. You want the truth. Okay. So look on their website and see if they have VA accreditation. If not, leave them alone. And you don't have to pay megabucks. So anyway, VA is very good to give us a warning. Good for them. Now, doctors can't get accredited, but you're going to have to decide if your doctor's telling the truth. Any questions?
Yeah, we have one here from Ray on Facebook. I've been diagnosed with iron deficiency anemia. I'm diabetic and have hepatic steatosis. Is there a way to connect one of these to anemia?
Your hepatic liver disease makes you not absorb iron. The bile puts that, it cuts down your iron absorption, and that gives you the iron deficiency anemia. Is it a VA or just a medical question?
Just a general question.
General medical question. My Lord, how long has it been since I've done general medicine? but yeah, because when you don't have the right bile, the liver's having trouble, you don't absorb things as well.
So,
by the way, iron's it's hard to absorb anyway.
all right. We have here from Ray McCarty. I was denied sleep apnea after using your services. I did have weight gain after surgery and service, was discharged for it, and it was still denied. Time of the rating, I could not speak to the tinnitus and diabetes that are.
Now you need to appeal that. You get an attorney when you get a denial, because all I do is nexus reports. You get a denial and you take it up. Either that depends on the state. If you go back to some states, you go back to same assholes that denied you, just a waste of time.
This is VA.
VA, yeah. So you can go to the Board of Veterans Appeals and Google VA Board of Appeals. Google the word Ellis, and you'll see Ellis. We relied on his report. Remand. Ellis. Remand. Go back. Do it. Because the judges on the Board of Veterans Appeals are lawyers. They understand the VA law is pro-veteran, and they adjudicate correctly. It's just that you're going to have people in here that won't accept the medical rationale. They have no medical degree, and you don't know who the asshole is that denied you, but they have a bias against your injured litigant, and they just turn you down. In some states, the rating officers are just awful. Some states are good. And so, depends on if you've got an asshole. Because they can do this with impunity. No one even knows their name. You only get to meet your accusers.
All right. I'm sorry I missed this. Hertz Jerker from YouTube. I'm service connected 60% right knee replacement 5 years ago. Had left knee replacement, tried secondary connection status. L3 to L5 fusion, secondary connection. Both secondaries were refused. Higher level review denied.
Well, did you get a nexus report explaining the mechanism how having a bad knee makes everything cattywampus? I mean, if you're 16 years old and you're on the beach and you let one flip flop off, you go back and get that, because just doing that makes a big difference. That's why chiropractors, if they just, walking upright's tough. And then if you have just a little bit of limp under VA and federal workers' comp, that means everything else is covered, including your back. You just need to have someone write it and explain it in English so that some fool will not be stupid.
So Ray McCarty applied here. They service connected me for diabetes and now on meds, so we'll go for increase. Headaches at 0, going for increase on that. Currently at 93%.
Well, he has diabetes at 90. All the stuff is 93%.
Yeah, all collectively.
Yeah. So he's adding it instead of using the formula. He's probably around 70 or 80 or something. Yeah, right. So read the question again.
Ray McCarty. Well, this is Ray McCarty. A previous question.
Okay.
He had said, I was denied sleep apnea after using your services.
Okay.
I did have weight gain after surgery and service, was discharged for it and still denied. At time of the rating, I could not speak to the tinnitus and diabetes that are service connected. And
So diabetes and tinnitus are service connected? If they're not, get a service connected. You gain weight in the service, that contributes to diabetes. And tinnitus, just basic training, is going to make your ears ring.
Yeah, I need some clarity from Ray. They service connected me for diabetes, and now on meds will go on increase. So I can't tell what specifically he said about if he was rated or not rated for tinnitus.
Well, you need to get ready. Everybody, I can count on my hand the few people that went in the service basic training didn't get ringing in their ears. Okay, so you need the tinnitus because then that contributes to sleep apnea and hypertension and strokes and heart attacks, and widows get pensions. So that's very important to get that.
Well, it's incredibly difficult, with the bureaucrats that are claims representatives. I know.
Well, it depends. Your claims exempt. Some are good, some are bad. Muskogee's pretty middle of the road. St. Louis does a good job. It depends on who you get.
Right. Let's switch back over to federal workers' comp. Because we've gained some more viewers since we initially started.
Okay.
And let's talk about the process for them coming to see you here at the clinic.
It's real simple. You go to ellisclinic.com, click appointments. So you may need an appointment for federal works comp, maybe VA disability, maybe federal retirement. Fill out the forms, follow the bouncing ball, follow the directions, put the records together like it says. I don't need every piece of paper. And then you send it to us, and then we review it, and then we call you and say, well, we need this or that, or we call and get you an appointment. Yeah.
Right. And here we go. We have another reply here from Ray. Diagnosed L5, S1, yet back 9. Can I claim second to service connected to diabetes? Yes, you worked on my tinnitus claim, now 10%.
What else was, what was the 10%?
The tinnitus.
Oh, it is 10%. Diabetes and back, I've never seen that. And and there may be case law, but I'm not aware of any medical evidence. Is there something else? Do you have anything happen to your knees or feet in the service? Yeah.
What's up?
Or weight gain, or and that would contribute to it. But diabetes and backs, probably not me probably not the guy to help you on that.
Mark Shippey, senior here from Facebook, says, I can't wait to talk to you on the 12th.
Well, yay.
So
Good.
So expanding on after the appointments with you is walk through the process.
Okay, so if it's VA, we do a report, give it to you, then you get your veteran service officer or whoever to go through electronically and send it to the VA. All right, or if you've been denied, you get your attorney to do that, look at it, and then you send it to the VA. Now, federal will help you set up an e-comp account. If you don't have one, that's how you send things electronically. Now, we're not your representative, we're not your lawyer, but we'll help you send your records in electronically to the government, and so that you can get your stuff approved quicker and walk you through it.
Right. So what's the time frame, to?
Oh, that's easy. We're trying to get this to your great grandkids. No. You might. So now it may take 6 or 7 weeks to get in here because we're swamped. So pray that someone buys me and I can train some more people because we're swamped. I mean, and if you call and no one answers the phone, I'm sorry. Just keep calling. There are just not many of us.
All right. We have here from Marcus Conley on Facebook. Hi, Doc Ellis. I have a question to see if you ever heard of this. I went to an oral hearing and my doctor wasn't a surgeon. So the hearing officer ruled in favor of WCP because they had a surgeon. He had more weight than the doctor who wasn't a surgeon. Is that bias or what?
No, that can be done. But what I say is that I'm a professor of legal medicine, professor of occupational medicine. And so I don't care if you're an orthopedic surgeon or not. I know more OWCP law. And so my report has more probative value. But that may not, but that's what they said. So that may be the hearing officer. They may be right. You can always, you don't ever give up, and you never quit. You never have to quit. You start over again.
Well, I am going here to bring McCarty follow-up. They service connected me with femoral and sciatic neuropathy, both legs at 10%, each secondary to service connected diabetes, thus aggravating L5S1.
Mm-hmm. Oh, well, okay, that's okay. So you had peripheral neuropathy, and okay, then I can connect your peripheral neuropathy from diabetes. I connect that to the nerves that down in your back down your leg, and that's aggravation. And then there you're covered. There you're covered. That's service connected.
So Kevin Knowles here on Facebook says, thank you for all your service. My migraines are service connected from a Nexus you provided. Currently 100 PNT.
Yay. Yeah, migraines. Woof. It's amazing to me, by the way. You've got classical migraine headaches. In other words, you can kind of tell it's coming on. Maybe you get a little trouble with vision, and then you have the throb, and bright lights bother you, and you get nauseated. And they're giving you ibuprofen and Tylenol and maybe an antidepressant, but not treating the migraine itself. It's the trigeminal nerve sensitivity. The reason you have that aura is the blood vessels constrict, and they may, sometimes you can even look like paralyzed on the side. Like, my God, I'm having a stroke. And then they die, and then the dilation is what hurts. So if you can take a sumatriptan and some other newer medications, you can actually abort a migraine. If you can stop one a year, that's worth the trouble. But I've seen a lot of people, especially they go to the VA, the doctor's not treating the migraine. They're treating the headaches, but not the migraine component. And there's some theology out there that all headaches are migraines, not just tension headaches. There's a migraine component. So make sure your doctor knows that there's a migraine, and they give you treatment for migraines. And you can Google it. What's the treatment for migraines? And then bring that into your doctor. It's going to piss him off because doctors' egos are such. But I love it when somebody brings something in from WebMD, or even better, bring a wife. The guys don't remember anything. And wow, that's an interesting thought. I hadn't thought of that. Let's look it up.
Well, Kevin Knowles previously replied to another user saying that keep a migraine log for 3 months.
Mm-hmm.
So
if you had 3-month migraines, you're 70% to 100%. But they'll rate you at 10 or 20 or 30.
And can you talk about the discrepancy of why there are different ratings for migraines?
Well, yeah, because people are assholes. And there's a bias against injured litigant. It's my migraine, it's 100%. It's your migraine, it's 10%. Yeah.
Well,
and they don't, and a lot of doctors don't understand that there's the book, if you look it up in the book, there's a range. Okay. But it's just like I had a guy that was rated PTSD, by the way, at 50%, and then he was dropped to 10 without having an exam. And he seemed to be upset. And I explained, I put in my report, the veteran seems to be upset. I've explained to the veteran, the doctor that lowered him without examining him must be the greatest doctor in the world. I'm not as good. I had to examine him. By the way, his PTSD is 70%. So it's just fraud, laziness. And just because we got a white coat on, don't trust us any more than politicians.
All right. So Gene, who previously asked a question here, I do have a question about saying no for burning your nerves for pain relief temporarily into the spine.
Burning the nerves?
Saying no for burning your nerves for pain relief. That's what it says.
Well, I think you're talking about an ablation. Now I'm going to give you a 1-dog study, me. At age 70, my bottom 2 vertebrae touch. It means there's no disc material. And I'm pitching the nerves to my little toes, big toes. That's S1 and L5 nerves. But I also know that the trigger is, and the pain area is not the traditional disc out here, but the little nerve that comes back here to this joint. And when you do it in a section, you can hardly see it. So I go to my excellent pain doctor and said, well, let's just try a little Novocaine on that and see if that makes the pain go away. It's like, which tooth is it? That one that went numb. Okay. So it lasts a month, and then when it wears off, and if it worked, then you go in and you put a little probe there and you microwave it, and you kill it. Okay. Well, this lasted 6 months. So I went in and said, hey, let's not wait for it to come back. Let's go do an ablation. And that's just a microwave of that little nerve. Okay. That was age 70. I was pain-free until age 82 and a little bit. And I started having pain. This time, that area again, but down a little bit. That's the sacroiliac joint. So I go back to this genius pain doctor. And so we'll we'll fill it up with some Novocaine, a little cortisone, and so I'm now pain free again. And we didn't get a bunch of epidurals and all that stuff, shotgun approach. We went specifically. If you went to a doctor and you said you've got heart pain, you'd find another doctor. A lot of people treat back pain. No, you need to know your anatomy and do it specifically. For I remember in Paul's Valley as a local family practitioner, this skinny lady had a lot of pain down the S1 nerve, and I was able to touch in her sacrum the little hole where that nerve is, and touch it and reproduce her symptoms out just barely under the skin. So I took some Novocaine and under the skin, gave a little numbness there, and it did. So then I, under local anesthesia, did a dissection, took a little bit of teeny lipoma out, and she's pain free. That's not in the book anywhere. It's just, but it's anatomy. Okay.
But as you said, the law is extremely fair when it comes to a courtroom, excluding the situation of a surgeon, not a surgeon. The white coat has the expertise needed to adjudicate.
Well, yeah, but in the courtroom, then the judge has to adjudicate between which of the white coats are we going to believe. Okay.
Right. We have here from Low Winds, and submitted my work comp because of injury due to COVID. Shot. OWCP said they denied it because shot was given prior to president executive mandate. Case was appealed and the board reversed and sent back to the claim.
So you're waiting for it be adjudicated again. Yeah. You might want to get a medical opinion in there while you're waiting for that. Give them some more information to go for your side, because it's back in limbo again until it gets re-adjudicated. But get it some more medical rationale.
So it seems like once the claim comes back from the Board of Appeals, is you have to reinitiate the process.
Yeah, just start over. And never give up. You just get another nexus report. Not even on a rebuttal, just you go through it.
OWCP.
Oh, OWCP. That you never give up on that. You can do it again. You just bring in more evidence, which is another doctor's report. The doctor's report is medical evidence. And then they have to look at it again. And if you have to, you do an oral hearing. Or you go to the Employee Compensation Appeal Board. And those judges are very honest. They call it like it is.
So specifically, he says case was appealed and the board reversed and sent it back to claim. Who asked why it was received prior to president executive order? I explained and provided that as a frontline government worker, my agency created a program to get the shot, and this is prior to the mandate.
I'd have to actually see that when they answer that. Yeah, but it's been remanded back. They need to reassess it.
Board reversed it and sent back to
reversed it.
Remanded. Yeah.
Yeah, they reversed it. But so in other words, it's in limbo. It needs to be readdressed, which means it probably should be accepted, or they wouldn't have reversed it. It's going to tick off a claims examiner.
So here's what he replies with. I provide multiple documentation. The claim officer said it's not enough. That my duty station is not helping to provide proof.
Well, your duty station is not trained in this.
So I guess what's the next step for him? If the board came back and said and remanded it,
then I would start all over again with the medical rationale report, and address and then the doctor has he can address the specific issues that were brought up.
And that would be, if he came to see you, you would utilize that to adjudicate why.
Yeah, we would go through this or that, and we address, so this is the answer to that, and this is that, and that's it. Just bullet points, make it logical and truthful.
Okay. Gene says, thank you. Makes me feel better getting an MRI. It's been 3 years since the last one.
Oh, yeah, because you're getting older and you're dying. You're over 16. Things deteriorate. Like I said, when I was 70, I didn't hurt my back, but boy, those discs are gone. Bad idea walking upright.
So let's talk more about the difficulties that federal workers encounter on the job when it comes to a claim.
Okay. If you have an acute claim, they're supposed to give you a CA-16 authorization exam and treat, and they're supposed to do it within 4 hours. You go to the doctor of your choice, they'll send it to, and people, the supervisors are not trained in this stuff, or they'll be biased, and it just goes to pot.
All right. So the difficulty with getting that.
So go to a doctor's clinic that knows how to handle that paperwork. Don't go to the company doctor. They may have an occupational division at whatever, like a tinker or something. Don't go to those people. They're not on your side.
But it's important to note for federal workers, they have a choice.
You have the sole right to pick your doctor. They can't tell you where to go. And yet they'll tell you where to go. They'll even ask for medical records for the supervisor. I get letters from the Department of the Air Force. Hey, folks, if you're listening, we need this letter filled out. We need this, and we need this and this. First thing I send them is the 13th Amendment, slavery stopped. Where's the check? Second, cite a reference that you can go directly to the treating doctor and ask for anything. And I send them a handout. You have broken a 1974 Privacy Act felony, not HIPAA. You can be fined or imprisoned for both. You can't. You may be the head of the HR department, the Department of Air Force, but you're dumber than shit. Know the law. Stop that shit. I can't send it to you. You have to go through your claims, the OWCP, and see if, and then you got to prove why you need it. Now, what we can give you is a CA-17. These are the work restrictions. We do that. Now, I would like we could, even on the form CA-17 work restrictions, it says diagnosis. That's a felony to ask for that, folks. You can't ask for that in the conditions. Now, I like to put asterisks with permission of the employee. Then I can write down he had surgery on his knee. He expects him back to hear that. And so that, because the supervisors will look at a form because they don't get to read the narrative reports. Like in state workers' comp, I can call Acme Brick and talk to the supervisor. Hey, the guy's knee's legit. Let's mow his lawn for the summer, and he'll be back to work about then. And everybody's copacetic and taking care of the patient, taking care of the employee. But I can't do that in federal. So they're not, and then of course, and then they're always going to think I'm the terrible, worst doctor in the world until they get hurt. And then that's where they come. Because I won't write a zero. I will not lie.
So we have here from Ray McCarty. I decided to use an in-state doctor to use a multiple symptom approach to sleep apnea. This time I'm getting a new nexus, rationale, and DBQ since they wrote multiple ACE exams against me in the last claim. I did not want to waste time on a higher level review since the new and relevant evidence not discovered sends service connecting other issues related to sleep apnea.
Well, good for the doctor and for the vet for doing that. Yeah. And if you can cite case law or you can cite medical literature, that helps too.
We have here from Oliver on YouTube. I was recently diagnosed with OSA, obstructive sleep apnea, and filed a VA claim. Can you assist me with a nexus and or DBQ?
Sure, we do that all the time. That's our bread and butter. Yeah, and so if you have tinnitus, I've got literature and case law that interrupts rapid eye movement sleep, and that's the nexus. Okay, and we cite the reference, and that, we just cite it, and then there it is. But then you may have gained weight because of some injury to your knee or something, and that's covered. Or you had GERD, you had a lot of regurgitation. I was talking to a guy the other day who was in Oman, and that's when he first started having GI trouble, and that contributes to sleep apnea. And it started in service, therefore your sleep apnea is service connected.
So let's talk about the implications of getting your, especially on the VA side, getting your conditions approved and what impact that has, not just for you, but after you die.
Mm-hmm. Okay, let's say you get tinnitus approved. You die of a heart attack or stroke, then your widow sends me their death certificate, and I will write a letter showing that contributes to hypertension, which contributed to the heart attack or stroke, and therefore that's a service-connected death, and the widow and the family get a pension. That's fun. That's fun for it. Now I charge $500 because I gifted off because you actually charge a widow. Well, I didn't go through the ceiling, but that's a fun day, or other things. So you're filing for your family, folks, and when they turn you down, it hurts because you put your life on the line for the GOV, the government, and then when the GOV screws you, it's personal. If you were working for Manpower and the state workers' comp claim and had an injury and had to get an attorney, I wouldn't be surprised. You'd be surprised if they treated you. But when the government, as either as a federal employee or as a veteran, turns you down, it's personal, man. Now, if you were living in Russia, well, that's life. We'll find out about it when we get to heaven. But we were raised on Superman comic books. Truth, justice, the American way. We're supposed to be the good guys. We're supposed to respect our government and government officials and follow the law. Yeah.
So it's not about them; it's about their family. With tinnitus,
You're going for your family. You're doing it for your family.
Talk about how tinnitus, just that rating and certain causes of death may indicate that your spouse gets payments for the rest
Right.
of their life.
And for instance, now tinnitus contributes to hypertension, and then if you die of a cardiovascular disease like heart attack, stroke, that's covered. And tinnitus messes up your rapid eye movement sleep. That's sleep apnea. That's worth 10%. And then you extrapolate out, you get a medical rationale out to the other conditions, which are higher numbers. It's worthwhile. But that's because the VA law is very, very pro-veteran and very, very fair. This wouldn't work in criminal law. In most states, it wouldn't work because they need 51% causation. So most states, I would not know. I'm not going to do ringing in your ears to sleep apnea, or because you're not going to win, okay? Because the law is set up that way, and we follow the law. And so the VA law and federal law are very fair.
Well, let's talk also a little bit about how some service members may be deterred from even filing a claim. What do you have to say?
Well, I understand. I've been doing VA exams for about 3 years. Well, then the way I was doing it, I was at a war memorial, remembering all the stuff I went through, but mostly my wife and daughter. And the Lord spoke verbally. Normally he speaks quietly. He said, help vets that. Oh, sure, okay. And become the guru now. Anyway, so I was doing these VA exams after about 3 years. I said, I ought to check my audiogram when I left service. I was a flight surgeon in the Army. Hell, I'm 20%. And I'll file for that and let my wife have that money, and she can go on Home Shopping Channel and QVC and buy jewelry. She's the one that has to put up with me being deaf. It's only fair. But it's hard to file. And then of course, if you're a Marine or 101st Airborne, I'm invincible. My classic case, I've probably told this 50,000 times. Anyway, Battle of Bastogne, 101st Airborne, Patton. Guy comes from New York with a back claim. I didn't ask him if he had PTSD. I thought it'd be a waste of time. I just assumed he had PTSD. I said, have you filed for PTSD? Nah. I said, well, I'm not doing your back unless you file for PTSD. Well, I don't want to do it. I said, well, go home. You can't do that, doctor. I paid you $500 for this exam and $500 and all the expense from New York. I said, see the hat? What do the bars mean, Sergeant? That's right. It's Captain Ellis. You're asking me to do a bad report. I'm not going to do it. You either file for PTSD or get out of my office. And you can't do it. I just did it. And I'm keeping your $500 and I'm calling it a stupid tax. Then I said, now, Sergeant, let me ask you this way. Has the PTSD interfered with your relationship with your wife and kids over the years? Okay, Doc, let's file the claim. So don't cut yourself short. When the Congress passed these laws, they want the vets taken care of. And you do too. You would kick some other vet's ass for not filing. Now you kick your ass and file this stuff. And don't give up if you're in one of those states where they screw everybody and you appeal. You get yourself an attorney. And it's like 90% of Social Security is turned down the first time. Doesn't mean quick. You get an attorney and win and they get $6,000. Shame it happens that way. But, you just be pragmatic. Okay.
Right. So Gene has a follow-up question. So my ear ringing can be related to my head injuries. My ear ringing can be related to my head injuries, could be the reason for high blood pressure.
Absolutely. The head injury itself, forget the ringing. This thing controls everything: blood pressure, your feelings, depression. Okay, so a brain injury, traumatic brain injury, and there's no such thing as a minor head injury, can give you ringing ears too. A different than the ringing of noise, but it's still a tinnitus. Okay, and it can do all that. So that can contribute to hypertension and at bad homeostasis, just because your brain's not working right, and that messes everything up. And it depends on how you rate the brain injury. Now, the way I rate a brain injury, because I go through all the details and stuff, then I look at the wife or the spouse. I said I can rate it 10, 30, 50, 70, and whatever she says is my scientific answer.
So, Lowe, or I guess his name is Larry from YouTube, we've answered a few of his questions, but I want to put it all into context. And his most recent comment, and I'll expand on it. The medical side is fine. The issue is the evidence proving the agency sponsored the vaccine prior to the mandate. So specifically in his situation, the board is reversed and sent back. So they're fine with the medical side.
And that's evidence of fact, right?
Yes, at least according to him.
Right.
And so what the claims examiner now is held up on is the evidence that the agency approved the vaccine prior to the mandate.
Right.
And so it's a timing issue. And so how does
he find out the data to do that? That's not a medical issue. He's got to find documentation of when that was done.
And I think that would almost go to what agency he was assigned to.
Right.
All agencies have to keep a historical record of their guidance.
Right. Right. And the other is, if you went ahead and you had COVID anyway, there's disability from COVID itself. And it may have not even been shot. You may have had, you got COVID with or without the shot. There's side effects from COVID itself. Which, by the way, is a common cold, folks. It's just this common cold will kill you. It's like all flu doesn't kill you, but in 1918 it'll kill you. So because the virus changes all the time. So you have kids go to school and they get sniffles, and then they're having that virus rechange and develop antibodies, getting antibodies. So there's no. It's hard. It's amazing we came up with the vaccines for the COVID, and they're different COVIDs, different vaccines. Wow. I'm impressed. That's Star Trek stuff, man. Okay.
Mark Shippey here from Facebook. Can having toe problems be an indicator of future back problems?
Having what?
Toe problems. Can that be an indicator?
Oh, yeah, especially the big toe. I mean, those toes are important, folks. You miss the toe, I'll rate you back. Yeah. Or a hammer toe or a fracture of the metatarsal at the big toe. Absolutely. Just that little limp that you're not even aware of anymore. That does major problems to the back and the knees and the hips.
And he's specifically talking about the toes being cold and burning.
Well, that sounds like a neuropathy from diabetes, or it could be the injury in the back hitting the nerves down into his feet, or both. And that could contribute to abnormal gait. That contributes to everything else, just as if you had a mechanical change.
Just for those of us who are less familiar with specific medical technology, or terminology rather, is gait.
Walking.
The
way you walk. Like the gait of a horse, the way you walk.
All right. Gene, let's follow up on YouTube. More like white noise. Never was rated for brain damage. I've been asking for a TBI scan, but no one will give it. But have a PTSD case.
Okay, no, so you need someone to write a TBI nexus report. And by the way, form number 8045, traumatic brain injury, the VA, is one of the best questionnaires. I use it for everybody. And you can go through that and come up with some math and stuff. Great questionnaire, because traumatic brain injury is diagnosed by subjective history. Your brain scan, MRI, the CAT scan is not going to show it. We're talking about little teeny ends of dendrites of the nerves being severed. That's not going to show up. And now if you have a blood clot in the brain, or that will, but and you still want an MRI of the brain, but it's probably going to be negative. That doesn't mean squat. Now, if it's positive, that's positive, but that doesn't mean anything. I remember years ago, I had a guy with a brain injury, and I'm calling the insurance company up, and I want to do a CT scan, and this lady, I developed a relationship, but was not going to authorize it. I said, "What page are you referring to? That he's not going to get a CT scan?" I said, "Have you got an MD degree? Now I've got your name, ma'am, and I'm going to get this scan. And if it's positive every year on this date, you're going to get a letter from me and a picture of this guy's family." "You're making me cry." "No, you're making yourself cry. Now you remember when I ask for something, you do it. I guarantee there's 99% chance that this CT scan is negative, but it's indicated, and I'm practicing medicine, and it pisses me off when somebody can practice medicine and can't get sued because it's not malpractice for them, but it is for me. Now you give me my goddamn CT scan and remember my name." Never had to call her again. She approved everything I asked. But that's what you have to put up with. Stupid people.
Gene follows up that I'm OWCP.
Okay.
Oh, right. Mark Shippey also follows up with the burning toes that he has back problems.
Right.
So, Larry follows up with respect to the case that was reversed. Sent back to the claims examiner, still waiting.
Still waiting for this is a fact issue.
So I'm on FERS because of this. If my claim is approved, will I be able to receive OWCP instead?
Yeah, we can. If what are you going to be for? You could be on workers' comp for this if that's what's keeping you off work. Yeah, you should. Yeah. And I'd like to talk to him and see, maybe we can go around it. Did something happen at work that made him not being able to work?
We're talking, so specifically, this is the individual
that had the vaccine.
Yes.
And had a result.
The claims examiner is holding it up because the agency documentation showing that it was a mandate.
He got it as a federal employee. Who cares about the mandate?
So yeah.
Okay. And if the government paid for it, if it's a mandate, it's happened on the job, makes it work related. But if it wasn't mandated, then you're off work because of the shot, and you're on FERS. But it's much better to be on workers' comp at 75% of your pay tax free than 40% taxable on FERS. So it's worth pursuing that and finishing it up.
We have here from Timothy on Facebook. Can you do an excess letter for IBS due to pain medication?
Oh, absolutely. Pain medication gets you constipation. Then all the bacteria go, and then your shit changes, and your bacteria changes, and your ecology changes, and sure. So when you go around, like if you go to certain countries, you're going to get the touristas, okay? Because what happens, about 50% of the poop is E. coli. And it's just a different strain with a different toxin that you're not used to. That's why if you go and you get touristas, you eat charcoal or lots of Pepto-Bismol to absorb the toxin. You don't take an antibiotic. You cannot kill all the bacteria in the gut. When you take an antibiotic, it throws everything off. But you can just move around the country, and some systems are going to have E. coli different than yours, and you may have little trots for a while if you move to that place to this place. So, of course, if you go overseas, some places don't have any clean water, and so it's irritable bowel, you get constipation, and it messes everything up.
Well, we have Larry responding again, the individual with the vaccine. I'm your patient already.
Oh, good. Next time you're in, say, I want to talk to Doc Ellis and ask him about it.
Reference the webinar and the vaccine.
Yeah. Because that sounds like fun. And I'll get my paralegal on. We'll put her brains together. She's smarter than I am, so that'll be good for you. Yeah. Let's see if we can't find another way to skin this cat.
All right. We've got time for one more here.
Okay.
We have Paul Johnson. I'm a current client of Ellis Clinic, and I have called every week and left messages and never got a call back. Is there a special process for returning patients that no one is telling me about?
Yeah, I have to apologize. I'm sorry. Send us a letter. Send us the facts
Right.
because we're swamped. I mean, we're just totally swamped.
All right. Well, with that,
Don't give up and apologize. We're not the government. We don't have unlimited funds and people.
well, with that, we will be back next month on the first Friday at 11 a.m. We will be answering questions at the top of that live stream if you submit them to askdocellis.com. So please feel free to ask your questions going there or hold them off until our next webinar. But until then, we'll see you next month. Any final words, Doc?
Yeah. God bless you, my beloved. I appreciate being able to help out. What a fun job.
All right.